Good morning, everyone. Thank you for joining our webinar today, where we're going to take you through an update on coronavirus. This is part 11 now of our webinar series. You can access all the other webinars. We've recorded them all. This one's going to be recorded. You can access them on our resources section on our website. So for those that are new to this webinar series, a bit of housekeeping before we get started. So all your audio is on mute. So if you want to ask a question, there is a question box, and I'll take you through what that looks like shortly. Hopefully you can all hear me and see my screen as well. In terms of timing, this is put in now for half an hour, so we should get through the content in that time and still save a bit of time for some Q&A at the end. In terms of the people we've got on our webinar today, we've got Audrey Robertson, who heads up our HR consultancy team here at Morpay, and we've got Phil Barker, who heads up our health and safety team here at Morpay as well. So they're going to take you through the webinar today, and also hopefully answer any questions that you do have during the course of the session. So in terms of agenda, we're going to go through some updates. It's been 2 weeks since we did our last webinar, so we're going to take you through a couple of updates that have come out from the government. Then we're going to talk a bit more, and Phil's going to talk about how we effectively get employees back into work safely. And then we'll talk a little bit around how we can support you, and then we'll save some time at the end, as I mentioned before, for some Q&A. So in terms of questions, on my screen, it comes up on the right hand side. There's a control panel for GoToWebinar. In there, there's a question box. If you put a question in there, we'll save it till the end, and we'll get it answered. I won't mention who's asked, or I won't name anybody who's asked the question. I'll just ask the question itself. Any questions that we don't get to, we'll come back to you with an answer post webinar. So during the course of the session, if you do want to ask anything, put a question in there, and hopefully we'll get it answered. So with that done, I'm going to pass over now to Audrey, who's going to take us through the updated stats.
Good morning, everyone, and thanks, Dan. Okay, these are the figures updated from yesterday. So there are currently 261,184 confirmed cases, and unfortunately the death figure now lies at 36,914. That's the figure for all settings for people who've died with a confirmed coronavirus diagnosis. Although the number of cases is obviously continuing to rise, that also has to be seen in the context of the much bigger testing numbers that we're seeing now. So yesterday there were 121 deaths reported. As we've seen in previous weeks, there's always a lag at the weekends caused by the reporting methods. But for comparison, the previous Monday there were 170. And there's also been a 12% decrease in the number of people in hospital with COVID. So although the risk remains high, these week-on-week figures are consistently better. The focus from the government is now on a phased end to lockdown while avoiding a second spike of infections. Dan, if we can move on to the next slide. So the latest announcement is the definite return of younger primary and year 6 children from next week in England. The government acknowledges that some schools may not be ready, so it remains to be seen what happens next Monday in terms of the school returns. Outdoor markets and car showrooms are also going to open on that day on the basis that they have a lot of outdoor space. It's now accepted the risk of transmitting the virus outside is considerably less as well. And all other non-essential retailers will open from 15th of June. That's provided they can meet the tests for being safe to do so. So in a few minutes, Phil will cover what that will look like. And it's fair to say, obviously, that they will be learning and have learned from all the essential retailers that have stayed open about how to operate in relative safety. Testing continues to grow in capacity. The government said last week that their test, track and trace system will be in place by 1st of June, and they've confirmed this morning that that's definitely the case. So we'll be hearing a lot more about that this week. And we're expecting to hear about the easing of restrictions in Scotland on Friday. The other development, I think, since we last spoke is that the 14 days quarantine is now in place for travellers arriving in the UK from overseas. That's with the exception of the Republic of Ireland, who actually have a very similar restriction in place themselves. And I think, is that right, Dan? We're over to Phil now, who's going to tell us a little bit about health and safety.
Yes, thanks, Audrey. The message at the top of the screen now is one that I've shared a few times before, and it's just a reminder there that the health and safety executive, whilst accepting that businesses need to operate and that there are public guidelines out there and that they're not going to stop anybody operating within the guidelines, they will take action if it's thought that people are breaching those guidelines or deliberately not following them. And also in the Prime Minister's briefing yesterday, basically there's a quote there that businesses can only open on the dates that he set out, so 1st of June, 15th of June, and then into July, where they can actually do a proper risk assessment, have a proper risk assessment in place, have consulted with the staff, whether that be through trade union representatives or direct in smaller businesses where unions aren't represented. And that they're following the COVID secure guidelines and in line with current health and safety legislation. So there's a real emphasis on risk assessments. There's a real emphasis on talking to staff. I just want to move on to the next slide, Dan, because we're going to this in more detail on the next slide. Regulation 3 of the management regulations stipulates the requirement for risk assessment within UK health and safety legislation. And then above that, we've got the Health and Safety at Work Act, which requires employers to look after their employees, customers, visitors, and anybody else affected by their activities. So there's a real existing legislative framework around health and safety that is being applied to coronavirus. So the steps we need to take are nothing new. They've been around since the 70s and the early 90s in respect of the management regulations. But what is key now is probably more than ever, we need to talk to stakeholders. We need to talk to our staff, our workers, our employees. And this school opening on the 1st of June probably highlights that in a grand scheme. You can't miss on the news where the unions are talking about not going back to work unless the staff feel safe. You've got parents talking around how they don't feel safe sending their kids back to school. And it really opens up why we need to be talking and really having proper risk assessments in place that have been considered, and we're communicating the safe systems and the safe return to business as usual or the new usual. And there's lots of guidance out there to work with. But obviously, we need to make sure that we've got risk assessment. The 5 steps of being COVID secure are on the right of the screen. So we've got a risk assessment in place. We've got cleaning facilities. We've got hand washing and hygiene procedures. We consider how people get from their home to work and back again. Are they having to use public transport? Are they using bikes? How can we help with cycle to work schemes, etc., etc. And also then, once we're in work, how do we maintain that 2-meter distance? If we can't maintain a 2-meter distance, what else can we put in place? Lots of things that we need to be thinking about. And if we're in a business that's going back to work on the 1st of June or the 15th of June, there's not really a lot of time to be thinking about this and to get things in place. I just want to pop onto the next slide for us, Dan. The other thing that we need to consider here is stress. People have been working from home 10, 12, 13 weeks, or they've been furloughed for the same amount of time. They're going to be coming back into a workplace. And on the screen there, we've got the definitions, or the 6 main areas, of work design that people feel stressed about. work demands, how much control they've got over their work, the support they've got, relationships, role and change. I've put in bold and underlined control and change because to me, these are the two things that are going to be stressing people out at the moment about potentially going back to work. It underlines why we need to involve our workers in the whole return to work and the coronavirus risk assessment process. This is probably one of the biggest changes most people are going to have had in their workplace. There's a risk out there, there's a hazard out there that's never been there before. There's a lot of knowledge around this. There's a lot of concern around it. So going back, there's a massive, massive change and a massive, massive culture change. So that in itself is going to be worrying people. They're potentially feeling out of control, that this new hazard in their workplace, they can't control what's happening with it. They can't see it. They don't understand it properly because the scientists don't understand it properly. So we need to really be supportive of our workers as they're coming back into the workplace. And then obviously support and relationships tie in with those two. But in my mind at the moment, those are the two key work area design things that a business needs to consider as they're getting people back into the workplace and getting their employees to understand the changes and to have some control as to how they're implemented. Helps not only with the risk assessment and a smooth return to work, but it will help reduce the stress off coming back to work as well. Just want to move on to the next slide for us, please, Dan. So the HSE, the Health and Safety Executive, in accordance with Public Health England, have put out some guidelines, and there's two there. One is about working safely during the coronavirus outbreak, and that is realistically just signposting people to the Public Health England guidance and also building a risk assessment framework around that. The other one is talking with your workers about working safely. And again, this really builds on what we've just said on the last couple of slides, consulting with your workers or employees, making sure that they're engaged, making sure that they're comfortable coming back to work. Now, I'll probably get this wrong and Audrey will correct me, but there is employment legislation out there where an employee can refuse to come to work if they don't feel safe. Now, we need to obviously be cognizant of that when we're doing risk assessments and engaging with our workforce. There is also the threat of businesses being whistleblowed to the HSE, on-spot inspections from the HSE/local authority. So if an employee is not feeling safe in the workplace, they've got lots of options to make that uncertainty or that feeling of unease known to the enforcement authorities. So it's very key that an employer has a risk assessment in place and they're having consulted with the employees as part of that risk assessment process. Without wanting to generalize too much, if 80% of your employees agree that you're safe and 20% don't, then I believe you've got a good case that you're doing everything you need to do. Obviously, there's a lot of nuances around that, but we need to have a documented risk assessment in place. Then that's the start point for defending any position, whether it's employees saying they don't feel safe and walking out, whether it's employees making reports to the local authority, or whether it's the HSE just dropping in for a spot check. The risk assessment and that consultation process that's gone along with it will be the bedrock of any defence, argument, case that an employer needs to argue in any of those situations. I want to move on to the next slide, please, Dan. So what are the key controls that we need to look at as part of that risk assessment process? Well, the key one, again, underlined and in bold, is the self-isolation. If any staff or any worker, any colleague has symptoms or other symptoms at home, that we isolate or that they isolate, sorry, in accordance with the guidelines. We continue to work from home where that's possible. And the definition is where possible, not where desirable. So it might be that you want to bring people back into the workplace for productivity reasons, but that is not an argument. They can still work from home, so they should still work from home. Travel to work, avoid public transport wherever possible, reduce car sharing unless people coming from the same household, offer cycle to work schemes. And we mentioned there last time that face coverings are now recommended. There's an argument for face coverings in and out of the workplace, and I could go on for that for hours, so I'll not start. But the face coverings that we're talking about are to stop an infected person infecting others rather than stopping staff from catching the virus from the surrounding atmosphere. Key distancing, key control there, social distancing, spread out, get 2 meters apart from wherever possible. There's loads and loads of people on the market now advertising and marketing perspex, glass, cardboard screens that you can use to separate people if social distance is not possible. Lots of sign making companies have been busy making 2 meter markers that can sit on the floor. So there's plenty of things out there now that we can look at to help enforce a social distancing policy once we get back into the workplace. Restrict access to canteens, because traditionally these are smaller places and social distancing is difficult. So look at giving people defined breaks, defined lunch breaks. Where we can't social distance, such as team lifting, can we avoid the task? Can we change it? We were talking to one client the other day who fortunately had relatives from the same household working within their business. So where tasks couldn't be done with social distancing in mind, they actually paired up people from the same household to do the task, so that they were keeping the risk within the same household. Ventilation, make sure we've got natural ventilation in the air, in the workplace, because that dilutes any viruses that might be in the air. One thing to be aware of, obviously, though, is we do operate in the UK with different legislation from different devolved administrations, and if you do work across borders, make sure that your procedures vary for the local variations in those devolved administrations. Want to pop it on to the next slide, please, Dan? So the government's got on their website, they've got loads and loads of posters now that we can use to help support the message around the business, around the workplace. These are all free to download. Obviously, you've got to print them off, laminate them, whatever yourselves, but there's loads and loads of resources there, and I've put the link at the top. I've also put there the Every Mind Matters. Again, if we refer back to the concerns and the worries that people have around coming back into the workplace. And last week was Mental Health Awareness Week, so you'll have seen lots and lots on the media and on the TV. There is a big challenge around mental health, not only for the last few weeks, but also for the coming months. People will feel concerned, people will be worried, people will be stressed. And the Every Mind Matters on the government website is a good place to go and get some resources, some guidance, and potentially some phone numbers that staff can phone if they're feeling concerned. So trying to move on to the next one for us, please, Dan. So other things to consider around when we're looking at going back into work. And remember, some of these sort of shops and other businesses that have been shut for 6, 7, 8, 9, 10 weeks, there's other risks that we need to consider before we go back in there. Just general building safety. Are the doors still there? Is the roof still there? Fire management safety systems. Does the fire alarm still work? Are the fire extinguishers still okay? Big one the HSE are pushing at the moment is Legionella management. If the taps haven't been run for any length of time, if the heating's been turned off, has Legionella bacteria had a chance to multiply within the tanks and the water system? Asbestos, which we up until previously was known as the invisible killer in the health and safety industry, but obviously coronavirus has got that tag now. But asbestos, have we got any damage in there? Has the wind blown any roofs off? Have we got any potentially damage to any asbestos materials that we know about within the building? Deep cleans, do we need to do one? Yes or no? Plant and equipment, are there any startup procedures? Do we need to make sure guards are back in place, serviced before we go and work on machinery? What staff are coming back? Are they fully trained? Do they know how to use all that equipment? Are any of the procedures that we're putting in place affecting fire exit routes, personal emergency evacuation plans, that kind of thing? How are we going to manage contractors when we come back into the workplace? Do we want contract cleaners in the office during office hours, or not the office, because we're not going back to work yet in offices. Do we want contract cleaners coming into shops while the shop's open? Do we want them coming in while the shop's closed? And last but not least, employee well-being. And again, just really want to reiterate, we need to consult with our workforce on risk assessments. They need to really understand what you're doing, why you're doing it, and how that makes them safe. That will help with stress, it will help with understanding, and it will also help with easing how you come back. It will make the return to work go a lot smoother than if you don't engage your staff at the earliest possible opportunity. And I think that's me done, Dan. I think we're back to Audrey now.
Yeah, I just wanted to give everybody a quick update as much as I can on the furlough scheme, and we know from our questions and so on, this is something that many of you are using and are particularly interested in. So to date, 7.3 million employees have been furloughed. We are looking at what's going to be happening in the future with this. What the government has said is that it will continue until the end of October, but from the start of August, employers will be expected to pay towards the costs of furlough. They're saying likely to be 20 to 30%. We've not got any details yet about how that's going to work. So we don't know quite what's going to happen. We do know that there will be options to return furloughed employees part-time. I think that's going to be something that's going to be really helpful, because at the moment it's a bit of an all or nothing. Employees must be furloughed for a minimum of 3 weeks and furloughed full-time. So I think that will certainly help people get to work. There's likely to also be a date put in place after which no more people can be furloughed, so there'll be no new entrants to the scheme. So we're going to keep an eye on this and let you know what's happening. But for now, the date to remember really is the end of July, and that's when the scheme is going to change. Dan, I think we've just got one more slide there. Is that right? Okay. As you've sort of heard really from Phil, all the things that you need to do, you can see there's quite a lot of overlap there between health and safety and HR in this situation. Many of the things that organisations need to do will lead to sort of employee relations considerations, changing hours, enforcing particular break times if you've never had to do that before. Some of the things that might arise from encouraging people back to work, some people who may be for the long term working partly at home, partly in the workplace, and that will take quite a lot of organising. And sadly, of course, I think we all have to face the fact there's likely to be job losses, potentially when the job retention scheme starts to change in August, but going forward from that as well. So if you're thinking about all those things and wondering how to manage it, what Phil and I have done together is team up our health and safety and our HR consultants to work as a team with our clients. So you can have a sort of tailored piece of consultancy that'll help you consider everything you need to do, working with health and safety or HR, whatever you need. Just one simple package really to help you, as it says here, achieve a safe working environment and reducing workers' concerns around return to work and everything you need to manage there. So definitely do get in touch with us if you want to find out a bit more about how that can work for you. And that's me done, Dan. I think back to you.
Yeah, thank you both. So we have had some questions in, so I think we're going to go to a live Q&A. So let me just pull up the questions. Bear with me. So the first question we've got is, do you think the rumoured 4-day week will be implemented? If so, do you have any thoughts around how this would work? Presumably it wouldn't be mandatory.
We don't really have any information about that at the moment, about whether it would happen at all, whether it would be mandatory. One question would obviously be how the days would be organised within individual organisations, and how it would affect people's pay. So it's quite a meaty piece, but no, we don't have any information on that at the moment.
Okay, thank you. Another question we've got is we have a staff health and safety group that we work with, many currently furloughed. Can we engage with them as part of the risk assessment, or will this be contrary to the rules RE working/providing services?
I'll go on that one first, and then Audrey will probably jump across and tell me when I'm wrong. I think there's a need to engage with that group around the health and safety point of view. Audrey, I'm not 100% certain how that would class as them furloughing. Whether do you want to jump in on that a bit? I think there potentially is a risk that they will be working, so they probably can't be. And it probably needs to be looked at and managed some carefully.
Well, of course, there's no lower limit for how long you bring someone back to work when they're furloughed, provided each period of furlough lasts for at least 3 weeks. So potentially you could bring people back for a meeting or series of meetings over 1 or more days and then re-furlough them, provided that was going to be for at least another 3 weeks. Obviously, if you don't think that it's going to be another 3 weeks, you'd have to consider bringing them back onto their normal contract of employment terms.
That's probably one that needs some careful consideration and a one-to-one discussion. If that's a client, I'd suggest that they phone the advice line and take some more detailed specific guidance.
You'd have to work through that to see exactly what you needed to do with your staff and how you could arrange that. But yeah, potentially you could bring people back for a very short period of time if that's suited.
Yeah, thank you. Another question we've got is if an employee has been working from home and wants to continue as they have an older partner who has other health issues, should they be allowed to continue to work from home for a longer period?
Well, currently the instructions are still that if you can work from home, you should, and you should return to work only if you can work safely there. So at the moment, anyone who's working at home should be allowed to continue to do so. We've not had any instructions to the contrary on that one.
Yeah, I'll just echo that as well. I mean, I think I mentioned in the presentation, the guidance is where it's possible to work from home, you do work from home. If not, where it's desirable to come back into work. So whilst ever there's the potential for people to work from home, then that is the preferred option.
Okay, thank you. Another question we've got. Hi, after furlough period ends, can we amend employee's contract to a short time working if it needs to?
Yes, in the same way that you've always been able to consult with employees to do that, and that means obviously demonstrating a business need, which presumably won't be too difficult in much of the current circumstances. If you consult with your employees, you don't have a right to unilaterally change their employment contract, but of course you can discuss amendments which might include temporary or permanent changes, or if you've got a clause to lay people off or put them on short time working, which has a specific definition, you can invoke that.
Okay, that's great. And I think the rest of, because we're just coming up to the half an hour mark, the rest of the questions are the kind of a bit more payroll related around claiming and calculations for the job retention scheme. So I think what we will do with those questions is take them away and get someone from our payroll team to answer them. Do you agree with that, Audrey?
Yeah, that's probably the best thing. I guess the only other thing I quickly wanted to say was that Phil mentioned about employees' rights in terms of leaving work where it's not safe to do so. That is part of the Employee Employment Relations Rights Act 1996, Section 44, and employees may not suffer any detriment, including dismissal, if they choose to leave a workplace that's not safe. So I'm not anticipating that happening a lot, but as Phil mentioned it, I just thought I'd clarify that at the end.
Thank you.
So we have had another question that's just come in. Some employees are keen to return to the office when they are allowed, even though they technically can work from home. The reasons, e.g., are that home environments are not conducive to work in easily. How do we respond?
At the moment, I think there's that's probably something you keep under constant review. But at the moment, they carry on working from home because it's safer. I think we might see that the guidelines from the government change and relax slightly over that, and that is obviously something that we're looking at very closely because we're an office-based employer as well. But at the moment, it's where possible to work from home, carry on working from home, and it's the desirable bit is there in that description. It's not. I can see where people would want to go back into the office, but at the moment, keep them working from home, but just keep it under review.
Yeah, that's great. All right, thank you. And I think we're just about run out of time there as well. So any of the, as mentioned, any of the payroll questions that we've not got round to, we'll come back to you separately with the answer to those. We're probably going to look at putting on the next webinar on June the 9th, so that'll be 2 weeks from today, unless something drastic comes out of, in terms of updates from the government or guidance, and we'll put something on a bit sooner. But please look out for an invite. If you after any more information, we update our knowledge centre on our website. We update that on a daily basis, so you'll find very different strands of information on there. So thank you for joining today, and hope you all have a great day. Bye bye.